Hi, welcome everyone. It's a pleasure to have you on today. My name is Dr. Heather White, and I'm the Executive Director at Together for Health. Happy New Year, everyone. I hope your new year is off to a good start in these first few weeks of 2022. Thanks again for joining us. And on behalf of our team at Together, we're pleased to welcome you to the next installment in our ongoing webinar series, which highlights global activities in cervical cancer prevention and control. Today's webinar will focus on the need for expanding leadership opportunities in cervical cancer globally. To provide some context on this issue, we will hear from our colleagues and friends at Pepal, whose organization brings together teams representing nonprofits, global corporations, and governments to learn from each other, empower leaders, and co-create solutions to urgent social issues. We'll then hear from national leaders in Tanzania and Uganda who will describe a leadership development model underway in their respective countries that is successfully building leadership skills of the country's public health experts and positively impacting cervical cancer prevention efforts in these settings. Following the presentations from our speakers, we will open the discussion up for questions and comments. So please do put your questions and comments in the chat as we go forward. Before we begin, just a few reminders with respect to logistics. We do have all of our attendees on mute to eliminate background noise. And again, a reminder to put in any questions or comments you have for the presenters in our chat box, and we'll do our best to get through all of those during our Q&A session. This webinar is being recorded and will be available on Together's website after the event. If you'd like to see the entire catalog of webinars, please visit our website at togetherforhealth.org. And as always, we'd love your feedback on today's topic or any other suggestions that you may have for future webinar topics. At the end of the presentation, we will post links on how you can get on our mailing list at Together for Health directly. Great. And with that, I would love to introduce our first speaker, Sarah Galvin, the Executive Director at Pepal, who leads the NJIA program based in Tanzania, Uganda, and India. Next slide. Sarah joined Pepal in 2018 as a programs manager. Before her tenure at Pepal, Sarah spent 5 years as the Executive Director of Phase Worldwide, a UK-based INGO empowering communities in isolated regions of Nepal to access health, education, and livelihood opportunities. Sarah has worked in the education sector in Cambodia and run experiential education tours throughout Asia. She has an MA with distinction in education and global development from the University of Leeds. Sarah is a CLOR Social Fellowship Fellow and sits on the board for the Southwest International Development Network. And she will spend a few minutes today introducing the NJIA program and tell us how it works. And with that, Sarah, let me turn it over to you. Thank you.
Thanks so much, Heather, and thanks for that introduction. So if we go on to the next slide, I just wanted to start by talking a little bit about Pepal, the organisation that I work for, and then we're going to move quickly over to talking to NJIA Cervical Cancer Programme. So Pepal is not an NGO that connects global corporations with NGOs and governments in the Global South. And we do that around a pressing social impact area that's relevant for the corporate company that we're working with. So for the NJIA program that we're going to talk about today, and NJIA means path in Kiswahili, we work with the Swiss pharmaceutical company Roche, and we focus on cervical cancer. So Pepal's been doing this work for over 10 years, and throughout our different programs, we create spaces which allow leaders from the corporate sector to use their competencies and skills to have meaningful social impact. And we, as part of that, we also improve the leadership skills of our colleagues from Uganda, Tanzania, and India. So this is the model we kind of work to throughout all our different programs. But today we're really going to focus on one of our programs, which is NJIA. So if we move to the next slide. So the NJIA program aims to impact cervical cancer by empowering the human potential. So supporting the leadership skills of those working in the health system. And the program currently works across 3 countries. So we've been working in Tanzania since 2015, in India since 2019, and since just last year in Uganda. And we selected these countries both because of a high burden of cervical cancer, but also because the governments in these areas were really committed to having impact in the cervical cancer space. So if we move on to the next slide, one of the kind of key things to highlight about NJIA and to really say from the start is that it's a collaboration, and it really allows the platform that we use and the model that we use really allows us to bring a lot of partners together in one space. So you can see some of our partners listed here. So governments, large and small NGOs, other technical partners. Yeah, we're really pleased to have so many great partners supporting our program in different ways. So some putting colleagues forward into the leadership program, providing technical support, coming to the pitching sessions, which I'll talk about in a minute. So different partners are involved in different ways, but it really is a collaborative effort, this program. So I'm doing a bit of a whistle-stop tour through it, but I can take more questions about different aspects of the program. So if we move on to the next slide, the hypothesis that really sits behind NJIA, which I mentioned, is can we impact cervical cancer? Can we save more lives by just or simply focusing on leadership? And in return, can that support our corporate partners to improve and strengthen their leadership skills? So that's really the hypothesis that sits at the heart of the program. And although we didn't formally test that before launching the NJIA program, what's emerging from the data that we've collected over the longer term is that this holds true and that this program is having an impact. So if we move on to the next slide. Over the last 6 years, NJIA has brought together over 300 leaders and really held patients at the centre in that leadership program. And I'm not going to talk in too much detail about the structure of the program, but as I said, I'd be happy to take questions or circulate further information after the call. But to give a sense, when the program was in person, as it was between 2015 and 2019, we brought colleagues from Roche together with frontline Tanzanian health workers together for a week, and they went through a leadership journey together. So as part of that leadership journey, there'd be some leadership theory covered in the program. Then they do discovery visits to research cervical cancer space and what's happening in the space. And then they develop an innovative idea, an idea that would make an impact. And that idea would be tested after the main immersion part of the program. And where ideas had the potential for scale or for further impact, we look at ways to scale those up. So that's a really brief overview of kind of how the program works. And the model follows a cohort model. So one set of leaders would build on the learnings of the last people who went through the program. The program's now moved fully online, and we ran four NJIA programs last year, and we're running around 9 this year. And it follows a very similar model, but it's just the immersion part of the program takes place over 3 weeks. So everybody still joins, and everybody joins online, and it's a program that takes place over 3 weeks online. So moving on to the last slide, just to talk a bit about the impact and the data. So what we did is we looked at cervical cancer screening numbers for the 4 years before NJIA and for the 4 years of NJIA in Kagera region where we work in Tanzania. And what we saw for the 7 out of 8 regions that has active NJIA leaders, the average number of screenings rose by 519% over the period. And we compared that to one control district where NJIA wasn't operating, and that control district has got the same kind of inputs as the other districts in this area, and only saw a 200% increase in screening rates. So we're really seeing that those areas with healthcare leaders who've been through the program are screening more women than the areas which don't have NJIA leaders. So the data is really showing that, and I'm just giving you one small snippet of data here. And I think Dr. Safina is going to talk about how Kagera kind of compares more nationally. But just before I kind of close my whistle-stop tour through NJIA, I just wanted to share one resource with you. One thing we noticed as a program, if we move on to the next slide, is that there wasn't a platform online that brought together resources that impacted in the cervical cancer space in low resource settings. So last year we launched a website, and I'll share the link in the chat in just a moment, where we aim to bring together a lot of the innovations that had come from the NJIA program, but also to share ideas and strategies that other NGOs and governments, etc., were sharing around the world. So we developed this platform which really shares a lot of the materials that we felt were useful. So yeah, I'll share the link to that website, but please do have a look at it. And if you do have strategies and ideas that you want us to share on this platform, please do send those to us, and we'd be really happy to share them on this site. So yeah, so that's all from me, and I think my colleague's going to talk in a bit more detail about different aspects of the program. But yeah, that just gives you a sense of what NJIA is.
Great, thank you so much, Sarah. That's really helpful. And now I'd like to introduce Dr. Serafina Yuma, who is the head of the Reproductive Cancer Unit of Tanzania's Ministry of Health, Community Development, Gender, Elderly, and Children. Dr. Yuma graduated in 2001 as a medical doctor at the University of People's Friendship, University of Russia, with a master's degree in public health and international health at the University of Melbourne, Australia. In her clinical practice, Dr. Yuma was a medical doctor at the Ocean Road Cancer Institute for 5 years. After obtaining her public health specialty, she transferred to the Ministry of Health to oversee the National Cervical Cancer Program. In this position, she has coordinated the development of the first national strategic plan of cervical cancer in Tanzania. She currently coordinates the implementation of cervical and breast cancer programs as the national point person at the ministry level. Dr. Yuma will share with us why she believes that leadership development is critical for quality healthcare delivery in Tanzania, and how partners at ICAP and Pepal are supporting this work through the NJIA program. And with that, I turn it over to you, Dr. Yuma. Thank you.
Thank you, Eva. Good evening, good morning. First of all, I would like to share the new name of our ministry. 2 weeks is changed the name. Now it's called the Ministry of Health. So they are separated the ministries. There are 2 ministries now. So it's called Ministry of Health. Today, I'd like to share how the leadership project support to improve the cervical cancer service, particularly in screening in Tanzania. Slide, please. Okay, thank you. So, as you all know, at all levels of delivered healthcare, leadership is required to understand and navigate the changes and see the impact of changes. We believe that in Tanzania. Even in the WHO highlighted that leadership and government is the cross-cutting issue in healthcare system strengthening. Healthcare system, so to have an impact of efficiency of delivery of the services. In Tanzania also, we know we have a medical profession which are also graduated and dealing with the client always. So always their skills, they are perfect in the clinical skills, but they have inadequate knowledge in leadership and management skills. Always the technical aspect. That's why we think to capacitate these managers, maybe they can do changes in doing things in difference. That's why we invest in capacitate managers to see what they're doing. So in that concept, we thought we can empower the healthcare workers in leadership and management position to expect changes in their leadership skills. But unfortunately, in this area, it is a little support in our setting. But NJIA came with a project in one of the regions in Tanzania, in Lake Zone of Tanzania. We implemented this project. We capacitate in 6 districts to capacitate the regional health managers and district managers who oversees the health system in Tanzania. So we think we can capacitate them and they can change. We can change the way of thinking. Slide, please. So in Tanzania, we have the target of screening women by 2030. And you can see the trend of the screening is increasing. So increasing is significantly slower. How we can do to increase? So by doing to capacitate the managers to think different, maybe they can have changes in that side, in their mind setting, and how we can improve to see things different and to increase efficiency, so they can capacitate even their people who they are managing to increase the trend of screening the women. But after next slide, please. After implementing the screening, the NJIA project, how to capacitate the managers, we can see the difference in the high-performing region. There are few high-performance regions. You can see how when the NJIA project was Kagera, there's an slight increasing of the number of women who screening, because maybe we think of this leadership management skill, the leaders can see the changing of the mind setting or the way they are thinking. So even their health workers can manage to change and increase their efficiency in the work, and can increase number of women by screening. So you can see from the 2019 compared to 2020, there's slightly increasing number in NJIA, and then now the region in 2020, the region which is high performance in screening, it was Kagera, where there's a NJIA project, the leadership project. Next slide, please. Okay, so even as you see, we have the strategic plan. We have the strategic plan which will guide us how we can implement cervical cancer service in Tanzania, and leadership is one of the components which is reflected in our strategic document. So we can input an enabling environment even for partners if we want to support in this area, because we see this area it is a little support in capacitate their leaders. So we think maybe we can invest in the capacitate the leader, so we can increase the efficiency. That's why we put one of the indicators in our strategic plan, because we have higher number of women who are dying for cervical cancer. So we want to make changes to increase the way of thinking of the leaders, to increase more effort in screening or prevention aspect, to minimize the number of women who are dying for cervical cancer. In this service of cervical cancer in Tanzania, there are just integrated services in the reproductive and child health section. However, there is also entry point where you can screen these women in the HIV component or in the family planning service or clinic. So there is integrated services. Next slide, please. As I can say, in our strategic document, we put this indicator, is reflected in this indicator. We put the 2 indicators just to see how many. We start with a few regions. We start to see the 10 regions, because we have almost 26 regions countrywide. So we start in few regions to see how many leaders can be committed to improve cervical cancer services. And in this 10 region, we want to see few facilities which they implement leadership commitment towards cervical cancer. So we have 2 indicators which we are tracking to see how the progress of commitment for the leaders to make changes toward the cervical cancer. However, the accountability or leadership is still there, but there are little reinforcement. That's why we want to put emphasis. So we want to in 10 regions and a few facilities. Next slide, please. What's the key component we think we can track in this when we put these leaders? There are a few things which maybe we think when their leaders can put or can change, but can have a change. So like self-awareness, card charter to prioritize, because there's so many intervention toward the maybe healthy cabinet. So cervical cancer always is being the lag behind because of lack of knowledge or of how to prioritize things. So in Kagera, we can see the how the impact of NJIA after it capacitate the leaders to think how the way they are thinking to prioritize which they are important, because we have the large number of the cervical cancer cases. So we want to prioritize this, prevention, so we can prevent earlier rather than to wait until the coming of the advanced stage of disease. Next slide, please. So after being with that component, we think if we capacitate the leader, we can see what we expect to see for the leaders. We can see maybe there's an increasing in the involvement of decision making, how to see things differently, and also to how to develop conflict resolution and team building within the region or the area of working place. So we can see the NJIA project help this healthcare workers, even the leaders, to make the changes. And you can see in the above slide, there's an increased number of women screened because of the changing of the leaders, maybe to put their more forces for these health workers to be screened in the clinics. Sometimes we have the clinics which provide this service, but because of the knowledge of the leaders, they don't put the person or dedicated person to go for the screening for that clinic. So you can see they don't know, but after being capacitated, they can see how to encourage the ownership of the intervention. You see, the good can improve the reduction of the cervical cancer cases. Next slide, please. So the last I want to share what they can see, what the impact of the NJIA. As you can see, the health worker, after getting the knowledge for the NJIA program, leadership management, so there's an increase of advocacy, because these health workers, they don't have mandate to have changing maybe roster. But after being capacitated with this leadership skill, they can be able even to convince their managers to allocate in the dedicated clinics, so they can provide cervical cancer services, so they can improve even the way of doing changing. To the management team or the regional managers, also we can see some changes. Some of the districts, they can be managed to allocate their budget. We have the budget, so the budget can be in council level. So you can see some of the districts, they already started allocating their budget in their district. So this can be able to manage their own intervention, particularly in cervical cancer cases also. So this is the impact of NJIA in Kagera. So it improves somehow, I can say, from the observation, it's improved the increasing cervical screening number in Tanzania. Thanks for listening.
Thank you so much, Dr. Serafina, and much appreciated, particularly this last slide showing the outputs, if you will, in terms of what you see, that the tangible outputs from the leadership program. I'd like to now turn to Dr. Oscar Rambo, who is the Senior Public Health Specialist at the CDC in Tanzania. And I will just quickly say to our next two speakers, we're running a bit over on time. So if you could just manage your presentations around 10 minutes and preferably just a bit under, if you would, so we could get to questions from our participants. Dr. Rambo is a medical doctor with over 12 years of experience working in the Tanzanian health sector as a clinician and public health practitioner. He's currently working with the U.S. Embassy in Tanzania at the CDC as the Senior Public Health Specialist there. He works closely with the Ministry of Health on system strengthening to support HIV prevention, care, and treatment programs. Previously, Dr. Rambo has worked with ICAP at Columbia University in Tanzania as a senior zonal manager for the 5 Lake Zone region, where he supported local and regional and district government authorities on HIV prevention programming. Dr. Rambo will share his leadership lessons from the CDC and explain the importance of building a leadership component into their ongoing work. Thank you and welcome, Dr. Rambo.
Hello, thank you so much, Heather. Actually, my other name is Rabiago, not Rambo. Thanks anyway. So, I just wanted to share with you a very small piece of my experience, and especially the lesson learned from my engagement with the NJIA leadership program specifically. And well, I think I'm one of, not I think, exactly, I'm one of the very first beneficiaries of the NJIA program when it started in Tanzania. And as you can see from, thank you for that, as you can see from that picture, actually, those are the very first cohort of NJIA program in Tanzania. So I participated in the first one and the second one. And what the motivation behind sharing it with everyone is that back then I was working with an organization, an international organization supporting the Kagera leadership called ICAP at Columbia University. And by the time the NJIA program started, this leadership program, that is the time actually I was just appointed to lead the regional team in Kagera. Now the team I was leading actually was the team of around 100 professionals, mainly health professionals, plus the other support staff, the administrative team. Plus other like 200 lay workers or peers who are also supporting the health program, mainly focusing the HIV prevention services in Kagera region. So, and I was pretty young, relatively young compared to, I think, the leaders who were around back then to take the role that I was just being entrusted with. So the NJIA leadership program basically came right on time. And to be honest, I'm proud to say that I learned a lot, you know, some kind of a very strong foundation on the leadership aspect that helped me and probably helped others through me, through the experience that I attained through the NJIA leadership program, through those two cohorts. So I've just highlighted the 3 areas which I wanted to share with you for the interest of time. I know we do not have a lot of time, but I think there are a lot to speak around the lesson learned and, you know, the whole experience of the of the leadership program for the 2 years I participated, but also the continued interaction with the people from different, the international folks, but also the colleagues in country, and overall the attachment to the NJIA program for all that period, and how it helped to be able to manage my team specifically, but also to lead the program and serve better my position to get to the intended output of what I was entrusted to do as a leader in Kagera for the ICAP program. So number one is, I think the very first thing I remember most of the tutors for the training were emphasizing is around communication. And I took, these are some of the key issues I took from the training. So number one, communication matters. And by communication, basically what I came to apply later was, as a leader, you need to learn to be able to, listen and accommodate everyone's issue or concern, have an open ear to listen to everyone. So we were taught so much on the skills of active listening, skills of and whereabout related to timely response when you listen, especially when it comes to your team. The team I was leading was really huge. I had the people at the highest rank, I would say, in terms of professionalism and position, but also I was leading the lowest people, like the lay workers. All those wanted to contribute to what we wanted to achieve as a program in Kagera. So I remember we had that meeting. It was early to mid a year. And then I started applying those before the second cohort. And the feedback I was getting, not just to my team, but also to the people who were overseeing me, was, okay, Oscar, I think we are seeing great change in terms of how your team listens and appreciates what you tell them, which was more important skills to gain, because, as I said, I was relatively a younger leader, a young manager, to manage such a big team, but also to manage a very big program as such. So the communication matters also in terms of making sure that we have regular meetings with the team to bring team on board and take every concern or issue that every team member raises seriously from the all levels, or make sure that it is attended. I think I will talk about that in the delegation point, but make sure it is attended. So for me, one of the things I learned is communication in all aspects, whether it is at individual or with the team. As a team you are leading is very essential, and that was very helpful tool to me and during my leadership right after receiving the training. I think I applied most of the things I received right away. The second one, which is more also equally important, is the team spirit and teamwork. Imparting and ensuring that the people you're reading understand that one cannot achieve what you're supposed to achieve as a team. So that was another very, very core issue. I remember most of the training that we received from all the trainers that we have around the team spirit. We are more on the, first on the experience of working as a team through the NJIA project. So after every cohort, we are having the projects which we were as a team following them up over time. A number of projects actually materialized to something very impactful. I can cite one example, the Kahawa project, which actually has helped in several ways to build up the structure of provision of cervical cancer screening in most of the sites in Kagera region. So those are the things which materialized. And then I was like, okay, so when you work as a team, and that was international team, we were working right in weeks of physical presence, but also people were dispersing back to their places. And then we had a room to continue working, and those projects were materializing. So what I learned from there basically was, when you bring team together of different aspects, different level of understanding, respecting and valuing everyone's contribution, it matters a lot. And that was one of the very key skill and experience that I applied. Lastly is delegation. I need to wind up. So again, you cannot, as a leader, you cannot achieve everything. I remember one saying from Steffi, that for sustainability as a leader, you need to start succeeding your roles at the very beginning point. And the translation of that was, you need to be able to delegate what you do to others and capacitate them to be able to take over even during your absence, but also make sure that you have the people who can do what you want to achieve as a leader. So that was another very critical point. I remember to date, I have the people whom I can refer. They are the product of my leadership in Kagera region, whom they have also gone very far in the leadership line, supporting different aspects of the health system in Tanzania, because I supported them, but also the right leader to them. And this is really, these are the thankful feedback I can provide from the NJIA leadership program. But lastly, as I am today, I believe I have aimed a greater leadership position is because I had the greater background and greater foundation. And I'm thankful to the NJIA leadership program because they made that stronger foundation that I'm proud of to date. Thank you so much, Heather. I think those are the few remarks from my experience, Asante. Thank you.
Thank you so much, Dr. Oscar, and apologies for mispronouncing your last name. I hope you'll forgive me for that. But very much appreciate your insights and your personal experience with the program and how you've been able to translate the skills that you've acquired into your work setting and what those have meant for your leadership capabilities. I'd like to turn it over to our next speaker, who is Mr. Michael Koima, who is the Leadership and Governance Manager at Baylor in Uganda. He will explain how to incorporate a leadership component into programming and describe the long-term impact of their work in Uganda. Briefly, Michael is working at Baylor College, at the Ugandan NGO Baylor College of Medicine Children's Foundation, Baylor Uganda. Before this, he was the project manager at Caring Together Leadership Project, also with Baylor Uganda. Caring Together model aims to use leadership, governance, and management to create an empowered, motivated, and accountable frontline health workforce in the country with the skills to adapt to the challenges in limited resource health systems. Michael holds a master's degree in monitoring and evaluation, a master's degree in human rights, a PGD in project monitoring and evaluation, and a bachelor's degree in adult and community education. He has been working over the past 7 years to facilitate national and international leadership trainings. And with that, I hand it over to you, Michael, and please forgive me, we're running very short on time. So if I could ask you to move through your slides quickly, so we'll have a few minutes for questions. Thank you.
Thank you, and good afternoon, good evening. It's here evening time in Uganda. I've already been introduced. I think we can move to the slide deck and then we continue, please. As introduced, Baylor College of Medicine is a Ugandan NGO that is committed to delivering high quality impact and ethical pediatric HIV/AIDS services. We are based in Uganda, but affiliated to the Baylor International Pediatric Association at the Texas Children's Hospital in the USA. So in Uganda, Baylor is registered as a local NGO, and in Africa, there's also Baylor, Tanzania, Malawi, Lesotho, and also others in Asia and South America. So Baylor works with Pepal to focus on embedding leadership and governance into our systems programming approaches that we deliver. And we have been working with Pepal since 2015. If you move on the next slide, you'll see that what we have been able to do, we have come out with 9 modules over our past work. So our leadership intervention, not only did it look at addressing the aspect of leadership challenges, but because leadership looked to be as something that is broad. When you talk about leadership, people and health workers would be, what exactly are you trying to address? So we came to discover that there could be some different components that if addressed, we could have quality leaders. And it is through these challenges that we work through with the teams that we were able to come up with 9 modules that we implemented in our Caring Together project, which covered areas of communication, time management, influencing skills, and teamwork, among others. And then on the next slide, you'll see that these modules went along with different tools. Because when you go to talk about leadership, let's say in a health facility, there is need to leave something in place as a tracker, a measure, an indicator, or a practice, which you think that once it is done regularly by these people, then you'll be able to track and monitor a change. So through this, that is how we came about with different tools that are used. I will, for example, here focus on only 2 tools. Like in the first row, you'll see what we have as the team performance monitoring tool. This is a tool that helps facilities and health centers to review and look at their performance on a regular basis, whereby they're able to set indicators which they focus on, monitor, and able to look at issues of improving them. Then below, we have the monthly staff meetings book. We discovered that in most cases, facilities get challenges because the people don't have time to sit, review, and reflect on the work that we do. And this may not only be applicable in health centers, but it can also be applicable in organizations and community settings or organizations. Once you don't sit to take stock of what is being done, it becomes challenging for you to know where you are heading, what challenges you're facing, and what mechanisms you can use to resolve these. So the meetings book helped us to see that people are able to meet, document, and design actions for improvement. Next. So this is the design or the approach which we used between 2015 and 2018. We piloted this across 2 regions in Uganda, in the east and in the west, reaching a total of 15 districts. And the design is centered from identifying a team of health workers who you train as mentors. And then these mentors are allocated health facilities where they go on a quarterly basis to provide this leadership support and mentorship. And in this provision of support, they are able to reach a number of health workers and a number of facilities whereby they are continue doing this role. Next. So after doing this, we observed some high-level results that we were able to share at the International Summit on Leadership in Healthcare that we hosted in Uganda. Number 1, we saw an increase in facilities able to track lateness through tracking arrivals of health workers coming to duty. And by doing this, it was able to reduce on late coming and late arrivals, or the absenteeism levels, by 27%. And in this, it increased the presence of health workers on station at time, thereby reducing the client waiting time. Because before this intervention, clients were spending more than 60 minutes to be seen by a health worker. But after these trainings on time management and improving communication and working as a team, we saw the clients spending almost 31 minutes, which was a reduction in the time waiting, thereby increasing the performance of teams and also teams performing better in terms of holding regular meetings. Next. So this is an example to show how we are embedding leadership into our programs at Baylor Uganda. The pilot, which you saw, ended in 2018, but after that, through our ongoing proposals and projects, mainly with the US funding and CDC, we're able to include this as a leadership intervention into these programs. And this has been funded. It led to the growth of a leadership department. And we have now included leadership and governance in all our HIV programming. And we continue to see an increase in terms of facilities using their data, thereby updating the team performance monitoring tools, tracking arrivals like you can see on the graph, holding regular meetings, and also the last one shows the performance of facilities having their health unit management committee meetings, which are key governance structures of a facility meeting on a quarterly basis. So these tools are widely used and we continue to scale them up, and our next step is to encourage the different partners to use the same in terms of addressing leadership and governance issues. Next. So leadership and cervical cancer in Uganda, we were able to take a team of 5 health workers from Uganda onto the NJIA program that took place in Tanzania. So when we trained these health workers who are the level of assistant district health officers, they have become now a force in driving and advocating for cervical cancer. One thing I can say about the NJIA training is that it helps us notice that sometimes we are part of the solution of the problems that we put forward. We only need to understand and reflect and look at resources within ourselves that we can use to address most of these challenges. So this has made these people committed, and NJIA was brought to Uganda in 2021, and we are trying to see how we can use the data to inform decision-making. And now that it is funded under CDC, we feel that this program will contribute a lot towards the identification, screening, and treating of cervical cancer in the regions of Uganda. Next. We see these leadership behaviors as being critical in terms of leadership. Leadership is broad, but when we are dealing with this group, we look at some elements which we think are critical, and we try to promote this. So we have seen these as the 3 main elements, and I'm glad Dr. Oscar mentioned about delegation. Delegation, we also see it as a very critical component in building leadership capacity and capabilities. A leader who is able to influence a team and inspire a team. When you're working in low resource facilities, you need an inspiration. This inspiration can be from within you or from within outside, or the people you look up to that can guide you to drive this. So these are the types of leadership behaviors we advocate for and we think can cause the change in the work that we do. Thank you, and I would like to stop from here and look forward to your discussion in terms to see how best we can take forward the issues of leadership in addressing cervical cancer in Uganda. Thank you very much.
Thank you, Michael. That was fantastic. I really appreciated the way that you broke down a lot of the specific skill sets that you're thinking of when talking about leadership. I would like to encourage anybody who has a question for our panelists to send it through in the chat. I see that there is quite a bit of discussions and introductions going back and forth. And thank you, Sarah, for putting your email address there for people who are interested in learning more about Pepal's program, how they can get involved, how they can potentially use some of the tools, et cetera, that you may be able to offer to their disposal. I actually have just a few questions for you all as panelists, as I'm going to be watching the question Q&A box, but if you will allow me just a couple of questions for the group. And I'd like to start with you, Michael. As you were speaking, I had written down several terms that came to mind as you were talking through what you've seen in terms of improving accountability, using communication, and as you said, inspiration to build rapport among healthcare workers, whether it be for cervical cancer prevention or otherwise. As I understand, this is a relatively new program for Uganda, and I would love your thoughts or ideas about where you see this leadership program and leadership development in general taking the healthcare system in Uganda over the next several years and say across the next decade. That's my first question, if you could just reflect on that a bit. And then secondly, do you have any advice for individuals or teams that may be listening today who understand the critical importance of leadership and would like to champion that within their sector, perhaps within, a government system, et cetera? How do you convince people to invest in leadership development?
Thank you. I will start with the last one. How do we create champions and convince people to invest in leadership development? We need to, first of all, every health system strengthening approach must appreciate the health system strengthening pillars, of which leadership and governance is the foundation. We may invest in all the other pillars of infrastructure, look at human resources and everything, but once we don't have a strong foundation, which is leadership and governance, then these interventions may not be sustainable or stand the test of time. So how do we influence and become champions? The first practical way is by use of data. Data has been a scarce resource. In most times we talk of issues as a challenge, but there is no tangible evidence and data to show how this is a problem. For example, when we went to Tanzania to share experience and attend the training as Uganda, we were able to learn that a number of women were dying from cervical cancer. But once this is not documented, when you conduct a screening camp and you screen and you find about 2,000 mothers, that's how you show the magnitude of the problem. And then once this data is brought to the attention of the district leaders and the stakeholders, then you are able to influence policy. By doing that, you are advocating and you can prioritize implementation of leadership. How this will take forward in Uganda, your first question being a new approach, we are glad cervical cancer has now been tagged along the HIV programming approaches, and we are hopeful that this will be carried forward. And the first one is to have the health workers have the capacity to confidently stand up and advocate for these resources. How can they bring this to the attention of their district health officers, the community leaders, and the stakeholders? If you are able to show how this is a problem in your community, then you get the influence and the buy-in. And at a later stage, we are looking at influencing the budgeting, decision-making, so that we have the enough equipment and resources that built on board. But all this starts with the leadership and the commitment from the staff and the implementers. Thank you, Heather.
Thank you, Michael. That's fantastic. I appreciate those thoughts. We've got about 5 minutes left, and I would like to just share one question that I would love to hear from both Dr. Serafina and Dr. Oscar. I'm thinking about the WHO cervical cancer elimination agenda and the fact that we have very ambitious targets to meet over the course of the next decade to 2030. And I'd love to dive deeper into the critical importance of leadership in moving forward the global elimination agenda. And if Dr. Serafina, if I could start with you to simply reflect on where you see a program such as NJIA and leadership as being of critical value to moving forward the cervical cancer elimination agenda in Tanzania. And Dr. Oscar, if you would like to comment on the same question. Thank you.
Okay, thanks, Heather, for your question. Yeah, at Tanzania also we have this agenda for WHO elimination strategy, and we are just implementing to move forward. And one thing is our leader is just champion in cervical cancer prevention. If even the introduction of PHPV vaccine is our president, the one who is the president now, is a champion or launching the HPV vaccine. And this agenda, we are just moving forward because we have educated the leaders, and also we have the strategic plan. So we are reporting, and we have advocacy plan to put a reinforce of implementing cervical cancer. As you know, we have a high burden of cervical cancer cases in Tanzania. So we focus in preventing as we capacitate leaders by doing advocacy to make sure they put as a high political will by capacitating even the parliament to increase budget by putting more effort in preventing cervical cancer as well in tertiary care. Thank you.
Great, thank you. And Dr. Oscar, I'd like to give you the last word, reflecting on leadership, both within the CDC structure and in driving forward the cervical cancer elimination agenda.
Thank you, Heather. So just learning from the previous years of this program supporting Kagera region. So just to share the vivid example, the district normally have what they call the country comprehensive strategic plan. These are the plan where a district is a administrative unit within a region in the setting of Tanzania. So normally these districts have their annual budget where they submit to the central government for the approval, and they implement that. Before NJIA, actually, we realized that most of the cancers were not actually even planning for cervical cancer. So they were planning all other aspects of health, but cervical cancer was not ever included. And most of them were thinking that actually the money was not enough. The money was not enough. What actually the program, this leadership program, enlightened the district medical officers and other leaders at the level of the region and district was that actually, no, you just need to plan well. You have enough money. What do you need to actually provide cervical cancer prevention services at the health facility? So after that discussion and, applying all the leadership approach, looking at the resources you have and what you want to achieve, it was realized that that was not, it was actually not possible. So most of them changed to accommodate that. So what I want to say in a nutshell, leadership can change a lot because it starts with showing you what you have basically can serve the purpose, which otherwise you wouldn't see. Asante.
Perfect. Thank you very much, Dr. Oscar. I want to thank all of the panelists today, and I very much appreciate your efforts in building the leadership component for health system strengthening and moving forward the cervical cancer prevention and control agenda in your countries. Thank you all for joining today, and we will be posting this webinar shortly on our website at Together for Health. Thank you. Have a great day.
Thank you, Heather.